Hi there, my name is Dr. Kelly Clarke, and today I wanted to talk about autism spectrum disorder. And there's three things that I wanted to bring up about it. I wanted to talk about defining what it is, so that we have an understanding of what it is. Secondly, I want to talk to you about some resources that you might be able to get if you do have a child you're concerned might have autism or is diagnosed with autism. And then also I would like to talk about how to get assessed for this condition. So what I wanted to bring up is there used to be previous terms for autism that you might have heard of. So it used to be called autistic spectrum or autistic disorder or Asperger's disorder. You might have heard of that one before, which would be high functioning autism. Or you might have also heard that there was a term called pervasive developmental disorder, not otherwise stated, and that would be an old term that we used to use for autism, but it's changed a little bit, and I'm going to talk about some of the new diagnostic terms for it. So diagnosing autism, or if you're concerned that your child, or say even yourself as an adolescent or an adult, might have autism, it needs to fit some of these criteria. Generally, it does fit a lot of them, but sometimes it doesn't, of course, meet all of the criteria. I'll also talk about just because there's one that might fit, for example, lining up toys. When a child is young, a lot of parents will be concerned, there was a lot of rigid kind of lining up. That doesn't mean that they have autism. It could just be one of the features and could reflect something else or just a personality trait. So I wanted to talk about the general criteria for autism and for you to reflect on, to think about. And if you fit a lot of these, your child, yourself, or your adolescent, you may want to consider getting an autism assessment. So the first criteria is a persistent deficit in social communication and social interaction across multiple contexts, as manifested by all of the following currently or by history. So the first area we want to look at are deficits in social and emotional reciprocity, ranging, for example, from abnormal social approach and failure of normal back and forth conversation, to reduced sharing of interest, emotions like flat affect, does not ask for things they want, does not celebrate or share other people's interests, or show emotion around play activity and things where there might be interest together with somebody else. So kids that struggle in these areas are the kids that they struggle with hello, they don't initiate conversations that well, they don't respond that well. So even though a child or somebody or an adult might say, hello, how are you doing today, Johnny? They don't reciprocate. To also that they don't necessarily share interest or share joy or emotion around activities. So even you might be doing something with your child, you're both into this activity, he clearly or she clearly has this as a preferred activity, and you go, that's fantastic, and there's just a flat affect. So when you see these kind of things, those are some of the indicators for deficits in social emotional reciprocity. And some of those examples are there for you to think about. Also moving on to, they also resist physical contact. So they don't like emotion, they don't like being touched sometimes, withdrawing, remaining aloof, and or they are just don't like hugs, don't like affection in general. So some of those things you want to consider when you're thinking about that reciprocal kind of emotional and social type of interaction. And a failure to initiate a response to social interactions, as I was saying earlier, that saying hello back or initiating is something we want to watch for as well. The second area under that persistent deficit in social communication and social interactions is deficits in nonverbal communicative behaviors used for social interaction, ranging, for example, from poorly integrated verbal and nonverbal communication to abnormal eye contact in body language, or deficits in understanding and use of gestures while talking, for example, very little hand movements. These kids or adolescents or even adults, when they're telling a story, they're not doing what I'm doing right now, which is moving arms or talking or articulating facial features while they're speaking. These things are common traits that are struggles for them. So there's a lack of that kind of reciprocity in nonverbal communicative behaviors. A classic one that, some parents or people will think of is the lack of eye contact. That's certainly one. But again, we don't want to just go that one is indicating autism. My own children, when I'm speaking to them sometimes, don't respond when I call their name or when I ask them some questions because they might be distracted or whatnot. But we just want to notice this it must be a significant departure for typical kids or adolescents or adults in this area of nonverbal communication, eye contact, those kind of things, facial expressions, flat affect. We want to be thinking about those things. To the third area in that area that I'm talking about, and that is, again, just to remind you that we're talking about persistent deficits in social communication and social interaction across numerous settings. The third area we want to look at is deficits in developing, maintaining, and understanding relationships. So, for example, difficulty adjusting behavior to suit various social contexts, the deficits in sharing imaginative play or making friends, to the absence of interactions with peers. So this might be the student that is constantly by themselves or constantly fixated on, the Lego or some kind of stereotyped interest that they might have, or an interest that they have over and outside in the room. They're lacking that ability or interest in interacting with peers. So there's that interaction, that communication lack that we should be seeing, or that you might see in somebody who might have autism. So that's the first area that we wouldn't really want to highlight. And back to what I'm trying to elaborate on there is a persistent deficit in social communication and social interaction across multiple contexts. Okay, that's the first criteria. The second one, and again, probably a lot of you may know this, is restricted, repetitive patterns of behavior, interest, or activities as manifested by at least two of the following or by their history. So we're going to go into stereotyped or repetitive motor movements. So sometimes these kids, adolescents, adults have stereotyped repetitive behaviors, rubbing their arms, rubbing their ears, their faces. So there's these repetitive behaviors that might be occurring like that. Use of objects or speech, so simple motor stereotypes, like, again, we did talk about lining up toys or flipping objects, to verbal repetitive behaviors like echolalia, which is almost this parroting type of quality where you might say, I had a good day, had a good day, good day, and they'll repeat or echo what you've said, or they might have a stereotyped phrase that they say on their own, but they say it in no context of the conversation. So while they're just playing with something or walking around, they go, good day. And so there's no person there, there's no interaction there, and the phrase just comes out. So stereotyped repetitive movements and or speech. The second one under this, again, restricted, repetitive behaviors, interests or activities. The second area we're going to look at is insistence on sameness, inflexibility, adherence to routines or ritualized patterns of behavior, and verbal behavior as well. So for example, extreme distress at small changes. So these are kids, adolescents, and adults that when there's a change in their setting, in their environment, or to a routine or ritual, they get very upset, way over the top. It doesn't typically meet most kids or individuals' type of behaviors. There's a big reaction to that. So difficulties with transitions. Kids with autism have significant difficulties with change, but also transitions. So moving from one activity to another. So maybe they're playing with some Lego and now they've got to move to go brush their teeth. Can get very disturbed by a transition like that. Rigid thinking patterns. So this is very black and white thinking oftentimes with these individuals. Greeting rituals, it can be difficult for them in that, they may not wave, so I'm talking about kind of more visual. They may not do those kind of typical things, again, looking at people, those kind of things. Or then, for example, another is to need to take the same route to school or eat the same food every day. So the difference between a ritual and a routine, and an individual with autism can like both. So a ritual is a series of behaviors that have to follow an invariant sequence. So I brushed my teeth, I wiped my face, then I went downstairs and ate some more food or a snack. So that say they really like not moving any of that ritual out of any order. They have to keep it, has to be invariant. And if there is a change, that ritual is changed, get very upset. A routine a bit different, whereas, I might like drinking my coffee in the morning and then looking at the paper and then talking to somebody. Maybe that's kind of a routine I like to flow. It doesn't necessarily have to go out in that order. I could read my paper first, I could or drink my coffee, but I do like, or the person does like, that routine to be consistent. So ritual is more rigid, and a routine, though, has to have features that are consistent. So any kind of differences in those, autistic kids, adolescents, adults can feel quite a lot of duress with that, okay? Third area, under that, again, we're talking about the second big criteria, restricted repetitive patterns of behavior, interest or activities, as manifested by at least two of the following. I've gone through the first two. The third one is highly restricted, fixated interests that are abnormal in intensity or focus. So for example, a strong attachment to our preoccupation with unusual objects, excessively circumscribed behavior, which means highly restricted, fixated with abnormal intensity. So they can really want to have an object, say, maybe it's a Lego piece, and if it's and they really like touching it, or they obsess on it, they want to talk about Lego all the time, they want to deal with Lego all the time, they insist on having Lego, that kind of high rigid intensity towards it, which clearly doesn't fit for most people, can also be an indicator of autism. And there's also almost like an obsessive quality about a rumination on it, both in interest and intensity. Another quality of this is hyper or hypo reactivity. So to sensory stimuli. So kids on the autistic spectrum can sometimes be highly sensory stimulated. So they might hear a door close, or good examples in the bathroom when somebody's washing their hands and then they use the dryer. That high-pitched dryer can send them, and you might even see them grabbing their ears and really getting a lot of duress over that high sensitivity to stimulating activities like those, sensory material, or an understimulation. So they don't actually respond much to anything. They actually may have an incredibly high tolerance to pain, not seem to react to many things. So that can also be an indicator that we'll want to watch for. And then also fixation on things that have to do with smelling, tantruming behaviors, visual fixations like maybe really perseverating or overly fixated on lights. So again, this really high intensity and high demand of certain sensory stimuli is something that characterizes some of the kids on the autistic or adolescents or adults. So another important thing about this is that, so these qualities that I've talked about, these characteristics of them, these symptoms must be present in the early childhood development period. So for it to just happen in, say, adolescence, it needs to have more of a sustained period. Another important thing is symptoms have to have a clinical impairment, in other words, a significant impairment on social, occupational, or other important areas of functioning. So it has to create some difficulties both at school, emotional life, social life, with peers, and say if it's an adult or an adolescent, they have a significant difficulty with jobs, keeping jobs, maintaining jobs, finding jobs. These disturbances should also not be better explained by an intellectual developmental disorder or a global developmental delay. So I wanted to, that's kind of a breakdown. That is a breakdown of some of the symptoms, many of the symptoms that outline autism spectrum disorder. Of course, there's more, but I wanted to give you a bit of a breakdown there. The other thing that I wanted to talk about is if your child is, say, between 6 and 18 years old, a great resource in the Edmonton area is the Glen Rose Rehabilitation Clinic. So it's the hospital clinic. There's a hospital program called SNAC, School Age Neurodevelopmental Assessment Clinic. And that clinic has availability for a multimodal approach for assessment. So you have a speech, occupational therapist, pediatric physicians that will take a look at these developmental challenges. And there's a multimodal approach to assessing your child if they fall in that age. It's a fantastic program. I would encourage you, if you have some of these symptoms that you're observing in your kids, you may want to access this program through your family doctor. But it's important to know that you need a referral from a mental health provider, a physician, and there should be a letter provided. You're also going to probably need a psychoeducational assessment. So somebody that does psychoeducational assessments, psychologist, would be somebody you'd need to get that report from, and then you could proceed with that assessment. The challenge with those assessments, although they're very good and there's a lot of expertise there, is in the Edmonton area, I just was phoning the Glenrose the other day, and the wait list is 2 years. So it's a long duration and waiting for those assessments. And so, various organizations, people that have expertise like pediatricians that might have this expertise can do the assessments, and also some psychologists who have the training in autism assessment, such as myself and others, would be a great source for you to consider when you're doing the autism assessment. So for determinations of autism spectrum, you may be wondering, well, what age can we start looking at this? You can look before 30 months old. So say the child is not speaking, which is, again, one of the symptoms of autism is nonverbal. They can struggle with developing speech. So if your child is below 30 months, there is assessment services for that. Also between 30, after 30, 31 months and beyond, if the child is not speaking, there still can be an assessment of autism for those children as well. To children and adolescents that maybe have just kind of phrase speech, right through it up to adolescence to adulthood, the assessment for autism can proceed with them. So really, you can look at getting assessed quite young for your child's needs in this area, and if you're an adult. So again, programs like I talked about, except the SNAC, for example, is you can't access it after 18. You could look at specialists like at Clarke Psychological Services. There are people psychologists at my practice, including me, who do this, as well as other psychologists that have this expertise. So I wanted to let you know that those are some of the ways that you can get the assessment done. The last would be, so if you find somebody, you determine that your child or an adolescent or an adult has autism, what's next? Well, when they're young, you can consider FSCD, which is Family Support for Children with Disabilities. So when the child is under 18 years old, you can go to a government website where you take a look at this service or this provider, and they provide free counseling, even speech, occupational therapy. These are some of the services that you can possibly connect through the FSCD program. And there are other various agencies that help out, including pediatricians, that you could look at for sources of information. The Glenrose Hospital as well has a navigation connection to help parents who are querying about these things. If you call their general line, they can also give some guidance there. So those are some of the things that I wanted to bring up today around autism spectrum disorder. And my name is Dr. Kelly Clarke. Thank you for listening.